12 for its high rate of suicide. And as I look at what can be done for possible solutions, I went to the Health and Human Services website, and I found an interesting group that works with the Substance Abuse and Mental Health Service Administration. And it's the National Alliance for Suicide Prevention, which is a public and private sector group that works on the National Strategy for Suicide Prevention, whose goal is lowering the national suicide statistic by 20,000 people in 5 years. The head of the private sector of the Alliance happens to be former Oregon Senator Gordon Smith, who lost his son Garrett to suicide in 2004. One of the groups sitting on the Alliance is the American Foundation for Suicide Prevention. And they work with groups that are working on trying to set a suicide prevention policy. And I actually am a member of the Foundation's Oregon chapter. What is trying to be done, while a good attempt, is not working. And I'm wondering if it's time to bring in a group like the American Foundation for Suicide Prevention to advise, because they work with groups working to set their policy. And I have here, and I'm brought for you, the business card for the Foundation Regional Director. I don't want to hear any more stories like this, and I know everybody here does. What I see happening is we've got so many groups all over the place trying, but it's time we've got to come together and work a joint plan. April 3rd, I sat at a meeting where I heard the head of the Florida Police Behavioral Health Unit saying the police are overwhelmed because it's not really what they're trained, mental health services is not what they're trained to do. I realize the county jail system is county, but a lot of Portlanders get sent to the county as well, and they're frustrated. I could go on, Commissioner Fritz, I did call your schedule, but I do have the card with me now.
And I just texted her, so if you could just stop by, we'll set that up as soon as possible.
Yeah, thank you for coming in. You know, I get daily reports from the police bureau of what they're doing. Overnight, something happens overnight. And just yesterday, the police bureau disarmed a young man who had a very realistic-looking pellet gun that looked like an AR-15. And I'm glad it ended that way. He went to treatment. But once again, they were the mental health provider. They don't want to be in that position.